Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about a condition called nystagmus. I think I've done a ton of videos on this, but really it's never enough. It is probably one of the topics that we talk about the most in our clinic every single month with patients who connect with us. Now, before I talk to you about how we treat nystagmus and a little bit more details about that, let's talk about how you can connect with us. You can call us if you're local at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You have one of two choices. You can either click on the schedule a consultation, schedule a time to talk with me directly, or you can fill out a questionnaire, which at the back end of that will give you some information and allow you to schedule a consultation. Now, let's talk a little bit more about nystagmus. Today, I'm not going to go into the different types of nystagmus and all of that detail, but suffice it to say, the most common is the kind that goes side to side. There's also an oscillating or kind of like spinning and rotating type of nystagmus, and there's an up and down type of nystagmus. And that's just really, really basic and not too technical or in-depth. But what we do when we have someone that we're working with who has nystagmus is we use syntonics or light therapy. If you've watched any of my other videos, you know I talk about this all the time. And the way that we are successful in helping our patients who have nystagmus to slow down the movement of the eye, help them to learn to stop, fixate, focus, and see better and gain binocularity is, first of all, syntonics, which is, again, light therapy. The patient puts on a pair of goggles. We have a very specific system that's tried and true and works. It's kind of a methodology that I developed, and now I actually train other doctors all around the world how to use this specific method of treatment in helping their patients to gain results just like we have. But there's a specific kind of method to the madness. We first kind of balance the brain and heal it from any insult or injury that may have occurred. So some cases of nystagmus do occur after some sort of injury. The second thing that we do is we balance out the central nervous system. The third step that we do is we balance out the hemispheres of the brain. And then fourth, fifth, and whatever happens to be more about balancing out the muscles up and down, side to side. And maybe there are some other things that need to occur for an individual in order to have success achieving a slowdown on the nystagmus. Now, what really happens? How can we actually help someone improve somewhere around as much as 80% of improvement with their nystagmus? Well, again, this kind of specific method of what we do with the syntonics is designed to help kind of treat and train the brain how to slow down the movement of the eye, and then to get purposeful fixation so that the individual can be able to see smaller details and see more clearly down the Snellen or the letter acuity eye chart. So most of our patients will achieve a 2-line improvement on the Snellen acuity eye chart. Some of our patients who work really hard are able to achieve as much as 3, 4, or 5 lines of improvement. But literally every single patient that we have ever had old enough to test, because we do work with infants and toddlers who also have nystagmus. But of all of the patients I've ever treated with nystagmus in the last, I don't know, since about 2013, I have helped them to achieve, or we have helped them to achieve 2 lines of improvement in their eyesight. Now, when I say I changed that, not I, because it's a team here at Vision for Life and Success. And with our therapist working with the patient whose job it really is to work hard to be able to build their visual skill. That team effort is what's really required in order to have a good positive result. Now, some cases of nystagmus will increase where the movement will move more if an individual looks off to an angle when the eyes are under stress or in just a stressful situation. And most of the time, unfortunately, for patients with nystagmus, that's when they're trying to read that letter eye chart. They tend to get really stressed about that. They tend to have what's called a crowding effect, where they have difficulty kind of picking out, the forest from the trees or the trees from the forest, however you want to say that, but basically seeing the details of an individual letter in the background of a bunch of letters is really hard for someone who has nystagmus. And so how we're able to help them achieve better eyesight, again, using syntonics in a very specific methodology that helps to train the brain how to slow down the eyes and to help them to be able to fixate and focus for longer periods of time to see more small details, like on the letter acuity chart. In addition, we also do regular vision therapy. Some of the tools that we use, this is a Brock string. We use lens flippers, kind of like these. We use something called an aperture rule, which actually right here on my desk is kind of in pieces, but I'll just hold it up and put it together like this. It actually does have some cards that go on it, and this device that looks like this, where this, it's like a little window that you look through to line your eyes up and be able to teach your brain to see a single one image with both eyes and gain depth perception. These are just a couple of the tools that we use for nystagmus patients. We also teach them to figure out where their null point is, which is an area that most patients have in which they can kind of twist, tilt, or move their head into, and the movement of the eyes will slow down or maybe even stop altogether. So all of these things, these tools that I've shown you, and then obviously the syntonics, is super important in the treatment of nystagmus patients. Now, if you have nystagmus or someone you know and love has it, then we certainly might be able to help you. You can give us a call at 618-288-1489. You can go to our website at visionforlifeworks.com, fill out a questionnaire, or just click on that schedule consultation to consult directly with me. If it's someone that you know and love, pass the video along. If you haven't done so already, we'd love it if you hit like and subscribe to our channel so that you get all notifications of when we put out other videos that I think are informative, sometimes cool, sometimes a little crazy, but definitely have a lot of information that's hopefully super helpful to you. Thank you.